Imagine you're paying, I don't know, like $3,000 for a luxury cosmetic vaginal facelift at a high-end med spa.
Right. Out of pocket, usually.
Totally out of pocket.
Mhm.
And you are, sipping champagne in the waiting room, reading this glossy brochure about rejuvenation.
Yeah, it all sounds amazing.
Right. Only to find out that the exact same machine, like the very same laser being used on you, was legally cleared by the government for burning off genital warts.
Which is just a massive reality check.
It really is. So today we are looking at the booming, highly controversial world of energy-based intimate devices. Welcome to the deep dive.
Glad to be here for this one.
Our mission today is to unpack a massive stack of sources for you. We've got regulatory warnings from the US FDA and Australia's Therapeutic Goods Administration.
We also have clinical guidelines from the British Menopause Society.
Exactly. And on the flip side of all that heavy medical literature, we have some incredibly persuasive marketing materials from aesthetic clinics.
And just to be clear up front, we aren't taking sides here or endorsing these marketing claims. We're just impartially reporting on what these sources actually say.
Yeah, we're just laying out the facts from the source material.
Yeah.
It is a fascinating collision of two worlds, honestly. You have established medical science running head-on into a completely unregulated frontier of aesthetic marketing.
It really is the Wild West out there right now.
And it all centers around one central question that we need to answer for you today. Are the lasers used in those luxurious med spas for cosmetic vaginal rejuvenation actually any different from the medical devices used in clinical gynecology offices to treat severe menopause symptoms?
That is the big question.
Okay, let's unpack this, because this topic sits right at the intersection of aesthetic marketing, a massive regulatory loophole, and genuine, often really distressing women's health needs.
Yeah, the distress is a huge factor here.
But I think to understand the clinics, we really have to look under the hood of the machines themselves first. We keep hearing this phrase, energy-based devices, or EBDs.
Right, EBDs.
What are these machines actually doing to human tissue?
So when we talk about energy-based devices in this specific context, we are looking at three distinct technologies.
Okay.
And they all deliver controlled energy to the vaginal and vulvar tissues. They are all chasing the exact same biological outcome, but their methods of delivery are completely different.
So what's the first one?
The first, and arguably like the most common one you'll see in the marketing literature, is the CO2 or carbon dioxide laser.
Oh, like the Mona Lisa Touch. I see that brand name everywhere.
Exactly. Mona Lisa Touch is a famous one. These operate at a wavelength of 10,600 nanometers.
Okay, that sounds very specific. Why that number?
Because at that specific wavelength, the energy is highly absorbed by the water inside our cells.
Oh, I see.
Yeah, they penetrate deeply and they are ablative.
Wait, so by ablative, you mean they're actually vaporizing the tissue?
Yes, they are literally flash boiling the water inside the cells.
Oh, wow.
Yeah, it vaporizes a micro-thin layer of the surface tissue. Basically, they create a grid of microscopic wounds, essentially drilling these tiny columns of damage deep into the vaginal wall.
Okay, drilling tiny columns of damage sounds intense. So if CO2 is essentially vaporizing tissue, there has to be a less aggressive option, right?
Right.
Like, do they all require that level of structural trauma?
Well, no. That brings us to the second type in our sources, which is the ERYAG laser.
ERRAG. Okay.
Yeah, and this one operates at 2,940 nanometers.
No, a much shorter wavelength.
Right. And because water absorbs this specific wavelength much more efficiently, the energy doesn't penetrate nearly as deeply as the CO2 laser does.
So it stops at the surface.
Pretty much. It dissipates very quickly right at the surface. So it is generally non-ablative or, only very mildly ablative.
Okay, so less vaporizing.
Exactly. It creates a photothermal effect, meaning it heats the tissue, but it doesn't vaporize those deep columns. It is a much more superficial, gentler thermal spread.
So those are both light-based, using different wavelengths to heat the water in the cells. Are all of these devices lasers?
No, actually. The third major category is radiofrequency, or RF.
Like Thermiva. Right, I saw that in the sources.
Yes, devices like Thermiva fall into this bucket. And instead of using light energy like a laser, RF uses electromagnetic waves.
Okay, so how does that work?
It generates resistance in the tissue, and that resistance creates heat. The key difference here is that RF generates deep, uniform bulk heating in the underlying connective tissues.
But without the surface damage.
Right, without ablating or burning the surface mucosa at all.
I was thinking about this while reading through all the clinical descriptions, and I think there's a really clear way for you to visualize how these three differ.
Oh, let's hear it.
Think about these treatments like different methods of lawn care.
Lawn care. Okay, I'm with you.
Yeah, so the CO2 laser is like aggressive lawn aeration. You're literally punching deep, tiny holes into the soil.
Right, pulling up those little plugs of dirt.
Exactly. It causes visible surface disruption, but the goal is to aggressively stimulate the roots to grow back stronger.
That's actually a really good analogy.
Thanks. Then, the RYAG laser is more like applying a liquid surface fertilizer on a sunny day.
Ah, so it just sits on top.
Yeah, it warms and treats the surface layer to encourage growth, but without tearing up the yard.
Okay, and the radio frequency.
The RF is like installing underground radiant heating beneath the lawn. You aren't touching the blades of grass on the surface at all, but you are uniformly heating the soil deep down to stimulate the environment from below.
That perfectly captures the mechanics, honestly. And the reason all three of those distinct lawn care methods exist is because they are all trying to trigger a very specific physiological response called neocollagenesis.
Neocollagenesis, so making new collagen.
Exactly. As women age, and particularly during menopause when systemic estrogen levels just plummet, the vaginal tissue undergoes severe changes.
It degrades, basically.
Yeah, it does. It loses collagen, elastin, and vital blood supply. The walls become incredibly thin, dry, and just very fragile.
So by applying this controlled heat, whether it's through vaporizing holes or using electromagnetic waves, these devices are basically tripping the body into an emergency response.
You hit the nail on the head. You are intentionally inducing acute thermal injury.
Right, on purpose.
Right. When you heat tissue to around 40 to 45 degrees Celsius, you cause immediate contraction of the existing collagen fibers. But more importantly, you trigger a massive inflammatory cascade.
The body thinks it's under attack.
It thinks it has been wounded. So it rushes fibroblasts, which are the cells that build connective tissue, straight to the area.
Like sending in the construction crew.
Exactly. It triggers neovascularization, which is the formation of new blood vessels. The body deposits fresh type I and type 3 collagen to quote-unquote repair the heat damage.
Okay, so the theoretical goal is that once this whole healing process finishes, you are left with thicker, more elastic, and better lubricated vaginal walls.
That's the theory, yes.
Tricking the body into healing itself by causing controlled fractional damage. I mean, it is the exact same principle behind microneedling for acne scars on the face, right? Just applied to a much more sensitive area.
It's the exact same biological concept.
Here's where it gets really interesting, though. We have this incredibly powerful cell-altering technology, and you can find it heavily advertised in a strip mall med spa, and you can also find it in a sterile clinical urogynecology ward at a major research hospital.
Two very different settings.
Very different. Which brings us to the core question of our deep dive. Can the devices in the aesthetic med spas differ from the ones in the gynecology clinics?
What's fascinating here is no. They're usually not different at all. They're often the exact identical machines. The hardware is literally the same.
But wait, how is that legally possible? Because when people see FDA cleared on a glossy brochure for vaginal rejuvenation, the natural assumption is that the government has run clinical trials and explicitly approved this laser to cure vaginal dryness.
And that assumption is exactly where the aesthetic industry thrives.
Okay.
To understand how identical machines end up in such vastly different environments, you have to look at how medical devices are regulated in the United States.
Which is notoriously complicated.
Very. Specifically, we have to look at the FDA's 510K clearance pathway.
510K.
Yeah. The 510K pathway was created decades ago with a very logical intention, which was to avoid stifling medical innovation.
Okay, how so?
The idea was that if a manufacturer invents, say, a surgical scalpel with a slightly more ergonomic grip, they shouldn't be forced to conduct a 10-year, multi-million-dollar clinical trial just to prove that the scalpel cuts tissue.
Right. I mean, they just have to prove it's basically the same as an older scalpel that we already know is safe.
Precisely. They only have to prove substantial equivalence to a predicate device that is already legally on the market.
Substantial equivalent. So it's basically a fast track.
It is. So a laser manufacturer can say, hey, FDA, our new CO2 laser ablates soft tissue just like this older laser from 1995.
And the FDA just signs off on it.
The FDA clears it for general surgical use, so things like destroying genital warts. excising abnormal precancerous cervical tissue, general incision, and coagulation.
General surgery.
Exactly. They were absolutely not cleared for vaginal rejuvenation or treating menopause symptoms or improving sexual function.
But once a device is legally sitting on the market for general surgery, doctors have a tremendous amount of leeway to use it off-label however they see fit, right?
Right, which is how we end up with these two entirely different parallel worlds utilizing the exact same machine.
Okay, paint that picture for us.
So in the medical world, the gynecology clinic, you have highly trained urogynecologists using these lasers to treat a recognized, often really debilitating medical condition called genitourinary syndrome of menopause, or GSM.
And GSM isn't just cosmetic aging. The sources detail how severe this gets. We are talking about severe vaginal atrophy, extreme dryness causing micro tears and bleeding, agonizing pain during sex, and recurrent urinary tract infections. I mean, it destroys quality of life.
It is a profound medical issue, and urogynecologists are often using these off-label lasers as a last resort for women who cannot use traditional hormone therapies.
Like breast cancer survivors.
Most notably, breast cancer survivors, yes. But then you step into the parallel world, the med spa.
Right, the strip mall.
Here you have non-medical professionals, estheticians and business owners, marketing these same surgical lasers for purely cosmetic reasons. They are selling designer vaginas, vaginal facelifts, and, tightening up laxity after childbirth.
Okay, wait, let me challenge that.
Go for it.
If the machine is literally identical, like the nanometers are the same, the heat settings are the same, why does it matter whose hands it's in?
It matters a lot.
But a controlled burn is a
Right.
controlled burn, right?
Mm-hmm.
If a woman is dry and in pain, and the laser causes a healing response that helps her feel better, why do we care if she gets it at a spa or a hospital? Why is it safer with the gynecologist?
Because of diagnostics.
Diagnostic.
That is the fundamental difference. And it is exactly why medical professionals are terrified of the med spa trend. In a gynecology clinic, a doctor is first diagnosing the root cause of the symptom.
Oh, I see.
In a med spa, an esthetician is treating a self-reported symptom without the training to spot underlying pathology.
They're just treating the complaint blindly.
Exactly. Let's say a woman walks into a spa complaining of severe itching, pain, and a feeling of tightness. And the spa sells her a laser package to rejuvenate the tissue. But what if she actually has lichen sclerosis?
Which, according to the sources, is a chronic autoimmune skin condition that causes intense inflammation, blistering, and severe scarring of the vulva.
Right. Lichen sclerosis requires prescription topical steroids to suppress the overactive immune response. If you fire an ablative CO2 laser at tissue that is already suffering from an autoimmune inflammatory disease,
You're just adding fuel to the fire.
you can trigger catastrophic worsening of the condition, permanent scarring, and severe unremitting pain.
That is terrifying.
It is. And furthermore, what if the pain is caused by early-stage vaginal cancer?
Oh, wow.
The laser might temporarily alter the surface tissue, essentially masking the malignancy while the cancer continues to grow deeper.
Because an esthetician isn't looking for cancer.
An esthetician isn't trained to perform biopsies or recognize precancerous lesions. They just see a paying customer and turn a serious medical issue into a cosmetic upsell.
Okay, if estheticians are misdiagnosing autoimmune conditions and masking cancers with surgical lasers, surely someone at the FDA noticed the injury reports piling up. Like, did the regulator step in?
They absolutely did, and the language they used was unusually blunt for a regulatory body. In 2018, the FDA issued a stark public warning.
What do they say?
The commissioner stated plainly that they were deeply concerned women were being harmed. The FDA warned that these devices have serious, irreversible risks.
Irreversible.
We are talking about third-degree vaginal burns, severe internal scarring, and chronic recurring pain. And crucially, they stated there was zero adequate clinical evidence to support their use for cosmetic rejuvenation.
And it wasn't just the U.S. The sources show Australia took even more dramatic action, right?
Yes, Australia's regulatory body, the TGA, actually conducted a post-market review.
And what did they find?
They found insufficient clinical evidence for both efficacy and long-term safety, so they went into their national registry and canceled all energy-based devices intended for vaginal rejuvenation.
They just banned them outright.
They physically forced some off the market, yes, but look closely at the relabeling loophole in that Australian ban.
What loophole?
The TGA banned the devices for rejuvenation, but they allowed the exact same devices to remain on the market and stay in clinics if the manufacturer manufacturer strictly updated their intended purpose to exclude vaginal rejuvenation.
Wait, really? So they just had to change the label?
Just the label. The Australian government essentially proved that the hardware wasn't inherently defective. They weren't banning the laser itself, they were banning the marketing.
So it proves the issue is the reckless, unsubstantiated promises being made to vulnerable patients.
Exactly.
So what does this all mean? The marketing is light years ahead of the science, the regulators are fighting back, the machines are identical, whether you're at a spa or a hospital. But stripping all the drama away, does the treatment actually work?
That's the million-dollar question.
Right. If a woman with severe genitourinary syndrome of menopause pays $3,000 for a CO2 laser, will her tissue actually heal?
Well, to answer that, we have to look past the marketing and look at the highest quality clinical data available. For a long time, the aesthetic industry relied on small observational case series.
Which are what exactly?
Basically, a doctor performs the laser, asks the patient, "Do you feel better?" And the patient says yes.
Which is incredibly susceptible to bias, because if you just paid $3,000 out of pocket for a painful procedure, you desperately want to feel better. Like, you need to justify the investment.
Exactly. Which is why the gold standard of evidence is the randomized, double-blind, sham-controlled trial.
Okay, the heavy hitters of science.
Yes. And a landmark study of this exact type was published in JAMA, the Journal of the American Medical Association, in 2021.
Oh, this is the one from the sources.
Right. Researchers took 85 women suffering from severe menopause symptoms. Half received the actual fractional CO2 laser treatment. The other half received a sham procedure.
Meaning a fake laser treatment. Like,
Yeah.
they put the probe in, made the exact same clicking noises, spent the exact same amount of time with the doctor in the room,
Yeah.
but the machine delivered absolutely zero laser energy.
Exactly. It was completely double-blind. The patients didn't know which group they were in, and the researchers evaluating their tissue and symptom scores a year later didn't know either.
And the results?
After 12 months of follow-up, looking at symptom severity, quality of life, and sexual function, there was absolutely no statistically significant difference between the women who got the real laser and the women who got the fake one.
Wow. I mean, if you're listening to this right now and you have personally paid for this laser treatment and loved the results, you are probably yelling at your device.
It's hard to hear, for sure.
It feels insulting to be told your relief wasn't real. But let's look at why you might be experiencing very real, tangible improvements, even if the laser itself failed the clinical trial. Like, what is actually happening in the body and the brain?
Well, the clinical analysis suggests two major mechanisms are at play here. First, let's look at the biology of the heat.
Okay.
You are delivering acute thermal trauma to the vaginal walls. That trauma triggers an immediate inflammatory cascade.
We talked about that, the emergency response.
Right. The tissue swells with fluid as white blood cells rush in. So in the short term, the vaginal walls will literally swell, which creates a physical sensation of tightness and increased moisture from the inflammatory fluid.
Ah, so you feel tighter and more lubricated.
Yes, but it's not permanent structural neocollagenesis. It's just short-term swelling from an injury, which fades over time.
Okay, and the second mechanism,
The placebo effect.
the famous placebo.
And we really need to reframe how we think about the placebo effect. It is not fake healing. The mind is an incredibly powerful biological engine.
How so in this context?
The ritual of going to a pristine clinic, being listened to by an authority figure who validates your pain, investing your hard-earned money and time into your own healing, that elaborate ritual alone can significantly alter a person's neurological perception of pain and sexual function.
Just the belief that you are being cared for.
Exactly. The brain releases endorphins and alters neural pathways simply because it believes healing is occurring.
If we connect this to the bigger picture, we have this highly marketed, incredibly expensive, out-of-pocket laser treatment that currently struggles to beat a placebo in gold standard trials. Why is there such massive demand for it?
Because the women seeking this out are suffering.
All right, the symptoms of GSM are real and painful.
Very real. This raises an important question about the history of women's healthcare, actually. To understand the desperation for these lasers, you really have to look at what happened in 2002 with the Women's Health Initiative study.
The WHI.
Yes, the WHI was a massive trial looking at hormone replacement therapy. Early data suggested a link between systemic hormone pills and an increased risk of breast cancer.
I remember that. The media ran with it, causing just sheer panic.
Panic is the right word. Millions of women quit their hormones overnight.
A whole generation of women entering menopause were suddenly told that the primary treatment for their symptoms would give them cancer. So they suffered in silence, making them a prime, desperate market for anything labeled a hormone-free alternative, like a laser.
Exactly. It created a huge void.
Ah,
But the British Menopause Society, the North American Menopause Society, and the major OBGYN colleges have spent the last 2 decades looking at the long-term data.
and what do they say now?
Their guidelines are now incredibly clear. The fear of estrogen, specifically local estrogen, is entirely outdated.
So it is safe.
Yes, hormone replacement therapy, and specifically local vaginal estrogen, is the gold standard first-line treatment for GSM.
Let's clarify local versus systemic because that's where the confusion lies for a lot of people.
Great point. Systemic HRT involves pills or patches that distribute hormones through your entire bloodstream.
Right.
That does have nuanced risk profiles depending on your personal cardiovascular history. But local vaginal estrogen, so creams, tablets, or slow-release rings that stay right in the vaginal tissue, is incredibly safe.
Because it's not going everywhere.
Right. It restores the tissue by giving it exactly what it's starving for without significantly raising estrogen levels in the general bloodstream.
That makes sense.
The clinical sources are unequivocal here. Local estrogen does not increase the risk of breast cancer. It is highly effective, vastly cheaper than lasers, and usually covered by insurance.
But there are still women who cannot or will not use estrogen in any form. Say an oncologist advises a high-risk breast cancer survivor against even local estrogen. Are lasers their only hope?
Not at all. The clinical guidelines highlight several proven, evidence-based alternatives that don't involve burning tissue.
Like what?
There is ospemifene, which is an oral medication that acts as a selective estrogen receptor modulator.
That's a mouthful. What does it do?
It basically treats vaginal dryness by mimicking estrogen in the vaginal tissue, but crucially, it does not act like estrogen in the breast tissue.
Oh, that's clever. The sources also mention vaginal DHEA, right?
Yes, DHEA is a hormone precursor.
How does that work?
You apply it locally, and the vaginal tissue converts it internally into active hormones, which improves tissue thickness and moisture entirely locally without raising systemic hormone levels.
Okay, so there are hormonal workarounds.
Right. And for structural issues like laxity or mild stress urinary incontinence, progressive resistance physical therapy for the pelvic floor has incredibly robust clinical evidence behind it.
You mean like working with a specialized physical therapist?
Exactly, to actually rebuild the muscular support hammock of the pelvis.
Think about it like this. Choosing an unproven, expensive med spa laser over standard vaginal estrogen or proven medications is like choosing an experimental out-of-pocket gene therapy for a mild headache when we already have Tylenol sitting on the shelf.
That is a brilliant way to frame it.
The medical societies are essentially saying, use the Tylenol first. If the proven, safe, standard first-line defense doesn't work, then we can talk about escalating to other options.
Right, but do not jump straight to the surgical lasers.
Exactly, especially outside of a heavily monitored clinical trial.
That is exactly the consensus.
Okay, we have covered a massive amount of ground today. Let's synthesize all of this for you. We started with the core question. Can the devices in the aesthetic med spas differ from the ones in the medical clinics?
And the answer is a resounding no.
They are identical machines, cleared through an FDA loophole intended for general surgery, but marketed in vastly different ways to vulnerable populations.
The difference isn't the technology at all.
No, the difference lies entirely in the expertise of the person holding the laser.
Exactly. Are you being treated by a medical specialist diagnosing a condition like genitourinary syndrome of menopause? Or are you being sold a cosmetic rejuvenation dream by an esthetician without the ability to screen for serious underlying diseases like lichen sclerosis or cancer?
True intimate health requires a thorough medical evaluation, not glossy marketing hype.
And right now, the highest level of clinical evidence heavily favors traditional established therapies over lasers.
Which leaves us with one final lingering thought, and this is something to really mull over. We talked about that 2021 JMO study, where the sham fake laser worked just as well as the real laser for women suffering from real intimate pain.
The placebo group.
Yeah. If a fake treatment did just the clicking noises and the attention of doctor can generate real relief, it reveals just how incredibly powerful the mind-body connection is in women's intimate health.
It's astounding, really.
It begs a massive question for you to ponder. In this multi-billion-dollar wellness industry, when you walk into that spa with the ambient lighting and the incredibly expensive machines, how much are you actually paying for physiological change? And how much are you simply paying for the psychological permission to feel healed? Thanks for taking the deep dive with us.